my name is Paige Bateman.
And my name is Sydney Wheeler.
And this is our nutrition project. Okay, so for our case study, we have a Latino American receiving chemotherapy. So the first concept we wanted to go over was some basic facts. So cancer is the leading cause of death among Hispanic people, accounting for 20% of deaths. They also have a higher risk for cancers associated with infections, such as the liver, stomach, and cervix. Those are the main types of cancers. Breast cancer is the most commonly diagnosed cancer among Hispanic women, with an estimated 24,000 cases expected to be diagnosed in 2018. That is still true in 2021. Breast cancer is still the dominant cancer in Hispanic women. It's also the leading cause of cancer deaths in Hispanic women, with 3,200 deaths per year. Prostate cancer is the most commonly diagnosed cancer among Hispanic men, with 13,900 new cases expected in 2018, and that is still true in 2021. Prostate cancer is the most dominant cancer in men. So cancer is a group of diseases characterized by uncontrolled growth and spread of abnormal cells. If the spread is not controlled, it can result in death. Cancer is caused by external factors such as tobacco, infectious organisms, and an unhealthy diet, and internal factors such as genetics and inherited genetic mutations, hormones, and immune conditions. And chemotherapy is one of the most powerful forms of cancer treatment, and while chemotherapy kills the rapidly growing cancer cells, it can also kill the healthy cells as well. As chemotherapy kills these healthy cells, it causes the different organ systems in the body to not work as effectively. So it's important to increase caloric needs ranging from 25 to 35 calories per day, depending on metabolism and activity level. And for Latino Americans, some risk factors were estimated to be obesity, excess alcohol, low fruit and vegetable intake, with lower contributions from red meat and calcium intake. So some cultural considerations. So as a nurse, you want to be educated on the culture and practices within the culture, and can be beneficial when creating a care plan for this patient. For example, Latino Americans have significantly larger servings of white rice, and they season it with tomatoes, onion, and garlic to make what they call a Mexican rice. Lower servings of vegetables are incorporated in their diet, and more grains. So it's important to recognize this so we can still validate their culture and create ways for them to stay healthy as well. And the prevalence of type 2 diabetes mellitus is 2 to 3 times higher in Hispanic Americans than in non-Hispanics. So accompanying this increased risk of diabetes is the increased risk of obesity. And in traditional Hispanic culture, women do not drink alcohol outside of small family gatherings. Men tend to have a relaxed attitude about drinking and are often more likely to drink and drink heavily. And beer is the preferred beverage, followed by wine and liquor. And Hispanics often have a high intake of fruit, dark green or orange vegetables, and an increased intake of saturated fat and sodium. Tortillas are often eaten with most meals, and a majority of animal protein is from ground poultry, pork, or goat. And here we have just a little chart of the different types of food and within the food groups that Hispanics like to eat.
All right, so next are 2 common medications used to treat cancer. First is Imbruvica, and it is a targeted therapy, and it kills the cancerous B cells, and it comes in a capsule or tablet form. It can be taken with or without food. They should be swallowed whole and taken with water. They are not to be crushed or chewed. If a dose is missed, they should take it as soon as they remember that day, and they should avoid grapefruit juice, and oranges that are normally used in marmalade, and St. John's wort. And then the second is Keytruda, and it's a prescription medicine used to treat cancer such as skin, lung, head and neck, colon and rectal cancer, bladder, and cervical cancer. And then those taking Keytruda should avoid caffeine, alcohol, dairy, fat, fiber, orange juice, prune juice, and spicy foods. What should patients eat before chemotherapy? They should try to eat light or bland foods such as plain or fruited yogurt, fresh fruit and cottage cheese, egg and toast, a toasted bagel with a small amount of peanut butter, cereal and milk, chicken rice soup with saltine crackers, and then during therapy they might want to take a little snack such as saltine crackers. And then what to eat after chemotherapy? They should try to eat small frequent meals and snacks throughout the day. They should eat something that's low in fat, and cooler or cold foods might help. And then they should drink a lot of fluids to prevent dehydration and help remove the byproducts of chemotherapy from their body. Water is the best, and then they should also take anti-nausea medication as prescribed to help manage their nausea. So there's a diet regimen for Latino American females with breast cancer. They should aim to drink 2 liters of water a day. They should have frequent meals throughout the day instead of 3 large meals. It's easier to digest. And then a balanced diet is best. They should aim for a variety of fruits, vegetables, grains, beans, nuts, seeds, and dairy products. Protein choices should be made from poultry, fish, seafood, eggs, beans, lentils, nuts, seeds, and soy products. They should try to get 5 servings of fruits and vegetables a day, and they should try to up their fiber to 30 grams. They should ideally avoid alcohol because a study has found that an increased risk of up to 15% for breast cancer when women drink up to 3 to 6 drinks a week compared to women who did not drink. Many patients may feel sick to their stomach after receiving chemo, so they should eat foods that are cool or room temperature, that don't have a strong odor, and that are low in fat. And they should avoid strong flavors, and ginger root may help settle an upset stomach. If the patients experience constipation, they should increase their fiber and fluid intake, as well as participate in low intensity exercise. And then if the patient is fatigued, they should reach for high protein snacks and eat small frequent meals. So a diet for Latino Americans with prostate cancer, they should aim for 10 servings of fruits and vegetables, and they should limit their processed and refined grains. They should aim for 35 grams of fiber, and then flaxseed is a good choice for that. And they should aim to consume olive oil, nuts, and seeds, especially walnuts and pumpkin seeds, avocado, cold water fish, and they should avoid butter and corn oil. And their red meat intake should be no more than 18 ounces a week. And they should avoid alcohol, and if they can't do that, then they should limit themselves to 2 drinks a day. And they should also avoid sugary drinks. So what should we educate our patients on? They should be educated on they don't have to throw out their normal diet. They should just modify it, maybe eat a little bit less of this and that. If they're feeling fatigued, they should eat a large calorie-dense breakfast and conserve energy by prepping meals that are easy to make, as well as using a delivery service. Those with GI problems should sit up 1 hour after meals, ensure adequate intake of fluids throughout the day, avoid foods that can exacerbate diarrhea, consume foods high in pectin, limit caffeine, limit hot or cold drinks, and limit fatty food. They should aim for 10 servings of fruits and vegetables. Those experiencing mouth ulcers and stomatitis should use a soft toothbrush, avoid alcohol-containing mouthwash, avoid spicy foods, dry foods, or coarse foods, cut foods into small bite-sized pieces, and eat room temperature foods. They can use straws and use meal replacement shakes, as well as well-fitting dentures. And then these are our references. Thank you for watching.